So here we are, back with River, and I wanted to go over a couple of things that should help you with dealing with some injuries. So first thing is that the majority of injuries that you are going to run into with horses are going to be on their legs. So I highly recommend that if you're going to spend some time learning about wound care and anatomy and things like that, definitely spend the time on the legs. The reason is that there's actually below the knee, there's no muscles. So everything below the knee is just ligaments and tendons. And so they tend to get injured a lot. There's nothing really supporting them. Sadie, get out. All right, let's start again. Okay, so we're back here with River, and we are here to talk a little bit more about some of the common things that you will run into when it comes to horse care and injuries. So you'll find that the majority of the injuries that you're going to run across throughout the life of your horse are going to be on the legs. There's lots of reasons for it. The main one for me that I always look at is the fact that there's no muscle in the leg once you get beyond the knee. So everything else down there is just tendons and ligaments and hoof structure. So if you're going to spend some time learning about wound care, learning about management of one part of the horse, the legs is always where I recommend people start, because that's what you're going to come across the most often. So what's happened here is River actually banged his knee in the paddock a few days back. Now, a lot of times I get questions of, when should I call a vet? It's going to depend, obviously, on your expertise and your comfort level. My rule of thumb is that if they've banged a knee and you have a wound, like an open wound, it's worth a quick call to your vet. The reason is that because of what I said, where there's no muscles really anywhere from the knee down, the chances of infection or a foreign body or swelling or things that you don't want happening inside the joint is actually a lot greater than you would assume. So even a benign nick on the knee could actually turn into something that could end up crippling your horse, because it could be something that gets into their joint. So anytime you've got something that hits the knee specifically, you should definitely call a vet. You're going to get some nicks and scratches along other parts of the leg, and you'll start to learn where your comfort level is as far as treatment of different wounds on the leg. So, as that develops, maybe you'll realize which injuries you do call for and which injuries you don't need to. So in this particular case, we were cold hosing, we were doing an antibiotic cream, we were doing ice boots, because we are in South Carolina, so our water doesn't get that cold for cold hosing. And we were just kind of treating the wound. And what would happen is his leg would get better, and then his leg would get worse. And so it got to a point where we did end up calling a vet in because the wound actually started to look worse. So even though his leg wasn't swelling, he didn't have a lot of heat, the wound started opening from the times that it did swell. So because of the swelling that was happening and then we were bringing it down, and then it was swelling up again, and then we were bringing it down, it actually opened up the wound a little bit. So we had a vet come in. His initial assessment was kind of the same as mine, which was it was a superficial wound, and we'll probably just try and make sure that there's no infection in it by giving the horse some antibiotics. And we use a broad spectrum antibiotic, which is SMZs. Where it got interesting was River's owner wanted to just make sure that everything was fine. And so we took out the ultrasound. And the vet went through on an ultrasound, and he actually located something that looked like it could be a foreign body. So just so you know, even vets, when they look at a wound and they think it might be nothing, sometimes it's actually something. So you always want to be very careful when they've got something that gets them at the knee. The side of the knee is less likely to cause issues, but this front of the knee, if you get a horse that gets kicked in the front of the knee and it's got a small laceration, absolutely 100% call your vet. Okay, so the next thing that you want to do is you want to understand how to clean a wound. So I've actually got mine already pre-mixed. Just one second. No, River, stay there. You're good. Okay. So I actually already have my cleaning solution pre-mixed. So I do use a chlorhexidine solution. I find it to be more effective than an iodine. So there will be some injuries where you will be asked to do like a betadine scrub. But for the most part, I moved to chlorhexidine because when I was breeding, this is what we would use in order to do umbilical cord dips. And the way that I looked at it was, if it was gentle enough for a foal, but it was effective enough to prevent infection through the umbilicus, I really wanted to go this way. Betadine and iodine have actually shown that sometimes they can be aggravating. So this is mixed with the chlorhexidine solution and water to make it a really light blue color. I do put it in old prescription bottles after I pre-mix it, and I keep it out of the sun. If you put this solution in the sun, which is also why I like having it in a tinted container, but if this solution goes into the sun, it's going to start breaking down, and you'll notice because the color fades. So anyhow, for what I use to clean, I actually buy rolled cotton, not like the cotton wraps that we use, but actually like cotton batten. I'll buy it in a roll, and I can just rip off pieces as I need in order to be able to clean wounds. So you want to make sure that you want to make sure that you're cleaning enough, but you don't want to be necessarily re-injuring an area. So make sure that you're applying some pressure and you're really kind of making sure that it's getting clean, but you don't necessarily want to be scrubbing away at this kind of a wound. Now, when you're looking at the wound itself and you want to make sure that it's healing properly, what you want to do is you want to make sure that you don't have any proud flesh. And what proud flesh looks like is it almost looks like skin that resembles cottage cheese. So it starts to get really granular. It doesn't look like just a scab that's forming. It starts to look like it's going to puff out. And in those cases, we want to make sure that we get something on that to prevent proud flesh from growing. What proud flesh is it's actually the horse's natural immune system. So some horses are going to be far more prevalent or far more likely to have proud flesh than others. So if they've got a very overactive immune system, what it does is it's just an overproduction of cells. And the problem is it'll keep growing and it can become a big problem. If you don't catch it early enough, a vet would actually need to come and cut it off. It's called debriding. And that is a very difficult road to recuperate from. Very time consuming, requires a lot of attention and a lot of downtime. So if you can stay on top of your wounds and make sure that you're getting eyes on them and make sure that you can see what proud flesh looks like. I'll try and add some photos to this particular video as an overlay so that you can see the difference between healthy tissue forming and proud flesh forming. It's going to save you a lot that way. So we're going to wrap the wound today for turnout because that is what we have been instructed to do from our vet. So you want to use a silver sulfidine type of cream if you've got it. I don't. I'm actually using this E3 medicated wound care cream. I really like this cream. It's got an antifungal, antibacterial, and antiviral, along with an insect barrier. So if I wasn't wrapping this wound, I'd be able to put it on there and at least know I wasn't going to get all the bugs into the wound. But that's what we're going to be using today. And we're also going to be using a few other things that I will go over. Okay, so we're going to be using a non-stick pad. This one here was from CVS. You can get it from anywhere. We're also going to be using a gauze roll. We're going to be using some vet wrap. And because it's a knee and it's very likely to slip if you don't, we're going to be using some Elasticon. So Elasticon is pretty expensive, but it's a very good product to have in your toolbox because you never know when you're going to need to wrap something that is, you know, a little bit on the funky side. So, or rather something that has a lot of movement to it. So what we're going to do is I'm going to bring all of this down here with me. I'm going to put it on a cotton because that's what I've got here with me here. And I can show you some of the tips and tricks of putting on a bandage. So the first tip is that whenever you are putting on a bandage, whether it's polo wraps, standing wraps overnight, or you're trying to put some vet wrap and a bandage on a leg, you want to remember one thing. You want to remember swimming the breaststroke. Sounds really weird, but it's the best way that I've come up with and that I've ever heard of somebody reminding people the direction that you should be wrapping legs. So it's very important to wrap legs in a particular direction and in a particular way, which we'll discuss today. But you can actually cause a lot of damage. Again, since there's no muscles down here, you can actually cause a lot of damage to a horse's legs by wrapping them incorrectly. So my advice is before your horse has an injury, get a pair of just polo wraps that you can pick up either used or new, it's up to you, and just practice wrapping your horse's legs. So when I talk about swimming, I'll be facing the same direction of the horse. And when I do this, this is the direction that I want to wrap this leg. So before we get to wrapping though, I do have to put my non-stick pad on this and medicate it. So when you got the non-stick pad and you've got your medication, some people will take it and they'll put it directly on the horse. There are two reasons that I don't do that. One is I don't want to get a bunch of hair in my cream. So if I have to, reach back in to get any more cream, I'm likely to contaminate this. And the other reason is that if you put it on the actual non-stick pad, it helps to hold it in place while you're wrapping it. So I'll just kind of put it all along here, get it nice and lathered, and then I'll stick it onto the wound. There we go. And you'll see how it just kind of holds there. It's not comfortable for him today, but it's not going anywhere at this moment in time. So now that I've got that in place, I'm going to start with my gauze wrap. Now, you probably want to get a set of scissors, which I will grab as well, because he's got little legs. It's just the knee. I'm not doing a whole leg here, so I'm probably not going to use all of this. So when you're looking at a roll, it obviously rolls out one way. If I were to put it on this way, it would be pretty cumbersome for me to unroll it as I'm trying to apply it to the leg. So what you want to do is you want to have the side that it's actually feeding off of as the side that you start with. And you're going to start on the inside of the leg. You're always going to start on the inside of the leg. It's the best way to ensure that you're not going to damage your horse's tendons. So I'm going to start here and I'm going to pull this across. Okay, and I'm going to try and make sure that I keep this bandage where it's supposed to be. And I'm going to come over here and that will help me to secure this in place. Now, where it becomes tricky or where it's important to think is that I'm not tightening when I go along the back of the leg. So as I come to the front of the leg here, I can pull that tighter and I can come across, right? And I'm not putting any more pressure, but I come across the front here and I can give it a little bit of a pull. Just going to keep it snug there, but not pulling. And then at the front again, I can pull. And then you don't want to have wrinkles in your wrapping. So I'm trying to do this slowly. I normally do this a lot faster. So I just want to make sure that I don't have any wrinkles in my wrapping. Again, I can pull it tight along the front. And then all I'm doing is kind of rolling it along the back. Okay, you got to put your weight on it, buddy. Thank you. And then pulling across the front again and bringing it around the back. Now, because it's a knee, I want to end with kind of this upward motion. So I'm going to come back up here and I'm going to do this just so that it doesn't slip down, which is what these wraps tend to do. And then I'm going to give myself enough material here so that I will end on the inside of the leg again. Okay, so we'll cut that off and I'll bring this over. And the nice thing about a lot of the materials that we use on legs, whoops, that didn't really cut, did it? Nice thing about some of the materials that we use on legs is that they do kind of adhere to themselves a little bit, or at least enough for us to grab the next thing. So that's kind of the way that works. Now, what you want to do is you just want to take a quick peek. I mean, this is gauze wrap. It's not going to get too tight necessarily, but you just want to make sure that you've got a nice, smooth kind of wrap around. Next thing we're going to do is we're going to grab vet wrap, and we're going to do it the same way. So again, if I tried to put it on this way, right, I'm going to be struggling. So I'll do it up here. I'm going to be struggling to kind of undo it. Whereas this way, it's not nearly as much of a struggle. So I'm going to start on the inside of the leg again. I'm going to pull it around the front. Notice all of my pressure is at the front of the leg here when I'm pulling this taut. And then, thanks, River. And then I'm going to bring it around the back. But I'm not putting any extra. Hold on, River, you got to move. You moved out of spot. All right, you're not helping. Let's reposition. We'll start that part again. Over. Good boy. Over. Over. Good boy. Okay. Jan-ho. Good job. Okay. So, again, when I'm doing this, I'm coming around here. I do like to be back behind the leg. That's my personal preference. But I'm going to start back here on the side of his leg, right? Pulling it tight along the front. Now I am going to be leaving a bit of white at the top here, and I'll tell you why in a minute, but I can pull a little tighter on the front. All I'm doing is swinging this around the back, bringing it here, and I can pull a little tighter along the front. And then I can, well, and it's already starting to slip. There we go. And I can bring it along the back here. Whoop. That's the end of that. So now, as you heard me say, that was already starting to slip. So that is why we have the elasticon. So the elasticon is basically like the sticky part of a Band-Aid. So we're going to take it and we're going to do it exactly the same way. So the thing is, that's why I said grab a pair of polo wraps. Because once you have the technique down, it works for all of these different applications. So only thing that I don't like, which, I mean, it has to be this way, is that it's sticky side down. So I am going to be wrapping this, the sticky side, towards the horse. So again, starting in the middle. And now I'm overlapping between his hair, that white part that I left there, and the vet wrap. And I can pull along the front and just wrap around the back. And then, because this is ungodly expensive, and us equestrians don't like to waste, I'm going to cut it off here. Okay. And there's that. And then, just for good measure, I'm going to do it along the bottom as well. So, when you get to the end of the elasticon, sometimes you have to be a little creative with how you put this on. But even as I am putting this on as just this piece that I've got here, I'm doing the same thing. I am going to start on the inside of the leg. I'm going to make sure that it's against this cannon bone. I can pull against the cannon bone, and then I'm just going to wrap it along the back. There we go. Now, River's knee is done. And we get to do that twice a day. So really keep in mind, keeping an eye on your horses, looking at what they're getting into, keeping your posture safe. And if it's a knee, make sure that you call the vet. Alrighty. And that's that.